Let's talk about crowns, how long they last, what you can do to make them last longer, and how you know when they need to be replaced. Well, if you look at dental insurances, which are notoriously stingy, they'll pay to have a crown replaced after 5 years. But in our practice, and most dental practices, the average lifespan or success of a single crown is a minimum of about 10 to 15 years. Now, there are lots of different circumstances that can cause a failure earlier, but also we aim to have that crown last you a lifetime, and crowns can last 40, 50, 60 years. The main factors that affect how long a crown will last in your mouth are oral hygiene, how well the crown is taken care of, the quality of the materials in the lab that was used, and the quality of the dental team that designed the crown and modified the tooth to have the crown put on top. While it may be convenient to blame the dental team when a crown fails, at the end of the day, you control your oral habits and the environment with which that crown lives. A lot of times through natural aging, the tissue will pull down, it will expose the neck of the tooth, and that area is a lot more prone to decay. So even if the crown is done well and you have a healthy mouth, sometimes you get decay underneath that sneaks in and causes the crown to be replaced. There are lots of varying factors that play into the lifespan of a crown. Proper oral home care and checkups with a regular dental team are crucial to make sure nothing is happening around the edges of the crown. Watch for these signs that will let you know when a crown needs to be replaced. Some of them are really obvious, as in the porcelain is chipped off, part of the tooth is broken, you feel a really rough spot that wasn't there before. That's the obvious time to come in and let us take a look. Now sometimes, if part of the tooth is chipped off, if it's in a non-functional area and it's not aesthetic, sometimes we can smooth that over and just continue on because the basic substructure of the tooth is still protected. Sometimes, however, if it breaks off in between where the teeth touch each other and you can't floss anymore and food gets stuck, something like that is going to need to be replaced. Another obvious reason to come see us is if the crown itself feels loose. Even if it's just a little bit, all that takes is a little bit of micro motion to clear up a space for bacteria to sneak under the crown. If that happens, sometimes it's as simple as removing the crown, cleaning everything up and putting it back on, or if there's decay or cavity around the edge of the crown, sometimes the crown has to be remade. Any kind of pain or sensitivity around a crown definitely needs to be evaluated. Sometimes it's just as simple as some recession where the gum tissue pulls back and then the neck of the tooth is exposed and it's a little bit more sensitive. That might be something that's more easily fixed with either a filling or a fluoride treatment or some kind of patch. And you may not even have to have the crown replaced. But sometimes if a tooth with a crown is hurting, something's going on underneath the crown and we have to take the crown off to evaluate and treat the underlying tooth. One thing you can also look out for in the mirror is if you see a change at the gum line where the crown meets the natural tooth. Now sometimes if there's recession and you see a dark line there, that can't just be the edge of the crown. A lot of times the older style crowns have a metal substructure and the porcelain, the tooth color stuff laid on top. And when that crown was placed, it might have been underneath your gum line and the gum's pulled back now and you can see that. Technically that's okay because the tooth is still protected. A lot of times when it's a front tooth, it doesn't look good. It's unsightly. You see yourself in pictures wondering what that black line is. A lot of times to fix that is to replace the crown with a material that doesn't have that dark line at the edge. So a lot of times crowns that look totally fine in the mirror when you're checking them out actually have some underlying issues. During your dental exam, the hygienist and the dentist are always checking the edges of the crowns to make sure the margins close, make sure nothing's sneaking under there. We're checking for cracks, we're checking for breakdown of the materials to make sure everything is sound and healthy. Crowns can't be guaranteed forever, but when they're done correctly and use a quality lab and they're in a healthy mouth and you do a really good job with your home care, our hope is to have them last a lifetime. If you're not sure if you have crowns that aren't doing their job or might be breaking down, come in, let us take a look, and let us reassure you that either they are okay or the solution we can have to make them better. Crowns are a great solution to protect your teeth and get a longer life out of your teeth, and we don't want them to become a problem as well. If you have crowns and you have a question about them and you want us to take a look, we'd love to help you out. So drop a comment below, click on the link, we'd love to hear from you. I'm Dr. Brett Langston, I'm here to help you watch your mouth. With a smile shine bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.